We're going live.
Okay, thank you and welcome to the April 2020 Health Committee meeting. Before we kick this off, I'd like to have Kevin read the roll.
Absolutely. Mr. Reedy,
Here.
Mr. Langdon,
Here.
Mr. Miller,
Here.
Mr. Tunney,
Here.
Mr. Ward,
Here.
Mr. Joyce.
Here.
So, Mr. Chairman, we have 6 present, and Mrs. Willingham, Mr. Kuhn, and Miss McLean Lane are excused.
Okay, thank you, Kevin. We have a quorum, so kicking the meeting right off. Under previous business, number 1, can I get a motion to approve the previous meeting minutes?
I'll make the motion.
Motion by
second it.
Mr. Ward, second by, I think, Mr. Reedy. All in favor?
Aye. Aye.
Any opposed? Thank you. Under current business, number 2, authorizing agreement with the New York State Department of Health and Health Research Incorporated regarding the expanded partner services program. I think is Mike McLaughlin joining us tonight for health or?
Mike's here.
Okay, so is there any questions for Mike? I think we gave Commissioner Whalen, who's been doing double duty these past 30 days, a break tonight. Any questions for Mike? Hearing none, can I get a motion to approve?
I'll make the motion.
I'll second it.
Sean, I think second by, was that Paul?
Pete.
Pete, I'm sorry. All in favor?
Aye.
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 Any opposed? All right, thank you. Number 3, authorizing a submission of a grant application regarding the Healthiest Cities and Counties Challenge Grant. Any questions? Hearing none, can I get a motion to approve?
So
I'll
moved.
make that motion.
And second by Mr. Ward. All in favor?
Aye.
Aye.
Any opposed? Any opposed? None. Thank you. Number 4, amending resolution number 365 for 2015 regarding the childhood lead poisoning primary prevention program. Any questions from the committee? Hearing none, can I get a motion to approve?
I'll make that motion.
I'll second.
Motion by Mr. Ward, second by Mr. Tunney. All in favor?
Aye.
Aye.
Any opposed? Hearing none, unanimous. Thank you. Number 5, amending resolution number 187 for 2019 regarding the Healthy Neighborhoods Program. Any questions? Hearing none, can I get a motion to approve?
I'll
So
make it.
moved.
Motion by Mr. Reedy, second by, can I get a
I'll
second? Peter Tunney, all in favor?
Aye.
Aye.
Any opposed? Unanimous. Thank you. Number 6, authorizing an agreement with the New York State Department of Health regarding the HIV/AIDS Surveillance Grant Program. Any questions from the committee? Can I get a motion to approve?
I'll make that motion.
Motion made by Mr. Ward. Can I get a second?
I'll second.
Second by Mr. Reedy. All in favor?
Aye.
Aye.
Any opposed? Hearing none, unanimous. Number 7, amending the 2020 Department of Health budget, COVID-19 funding. Any questions from the committee? Hearing none, can I get a motion to approve?
I'll make that motion.
Motion made by Mr. Ward. Can I get a
I'll
second? Second by Mr. Miller. All in favor?
Aye.
Aye.
Any opposed? Hearing none, unanimous. Can I get a motion to adjourn?
Mr. Joyce, I have a question that maybe I was hoping, I know Commissioner Whalen has a much deserved break tonight, but maybe Mr. McLaughlin will know or could find out. I had a constituent ask a question about antibody testing. And I don't know if there's any sites available now or planned in the near future that maybe we could get the word out or at least know about.
So no, I can speak to that at least generally because there really aren't any specifics, unfortunately, on the county level. So similar to the sites that we were finally successful after a multi-week effort to get up and running in the city of Albany, we are also trying desperately to get antibody testing as well, at least in a form that is not like the random form the city's doing, right? Or the city, excuse me, the random form the state's doing in the sense that
Correct.
they're putting up pop-up sites, which works for their purposes, but from a wholesale testing perspective doesn't work. So to your point, if we're doing large scale antibody testing, right now, I think that the state's kind of keeping that pretty close to its chest. We don't really have the tests themselves and don't have the capability either. So I guess it's a long way of saying that it's part of the conversation because parallel to this conversation about opening things back up, right? Everyone's talking about that. But with that comes this need for both testing, but because testing is really just a shot in time, right? Like you get tested and let's say you're negative, well, that's great, but you could get infected later. Or maybe you're negative, but you also need another test because maybe you've already been exposed. So, it's all part of a larger conversation that we're having. The antibodies really more with the state DOH, and Homeland Security, where a lot of the equipment or supplies are coming from, because the antibody testing kind of came online later, and so it's then being put in place later. There's a significant hope, and we're trying to get that up and running as quickly as possible for obvious reasons.
Okay. Thank you.
Mr. Chairman,
Yes, Paul.
just a generic question. This is the Health Committee. We had one RLA which allowed us to accept $30,000 for COVID-19 efforts. I can't begin to imagine what the Department of Health is spending and the county's effort at tracing and quarantining and tracking people. This is a question really for Mike McLaughlin. Are we aware of any other funding streams, or how are you pulling this off on the short term?
Yeah. So, we're tracking every piece of expense that can be connected to COVID-19, right? Now, in terms of the different funding streams, like, of course, I don't remember off the top of my head. This funding is coming from, I'll just talk generally. So, we have multiple different funding streams that are going to be coming in, well, we hope, from the federal government or from the state government, state Homeland Security, FEMA, a State Department of Health. There's also waivers that are being given for certain funding streams that can be retooled to be used for other things. As an example, on last night's social services agenda, there was congregate meal funding. And so I mentioned, just so everybody knew, like there's a waiver that's come out so that funding can be reused for home delivered meals, because there's obviously no congregate meals going on right now. In addition, there's extra funding, discretionary funding that is being given to us in block grant form that we can use from NYSOFA for different COVID-related activities. So to answer your question, what it is we will be tracking all these things. And then once we know the universe of different funding streams that can be available to us, they'll be put into the funding stream that is most appropriate for them. And frankly, there's going to have to be an analysis done of which ones have the highest reimbursement rate, because I think everyone on the committee can understand that we don't expect every funding stream to be a 100% reimbursement rate for the activity that was done.
Thanks, Mike.
Chairman
I have a
Joyce?
question.
Lynn, Lynn, did you have your hand raised?
I did. Old school hand raising. I'm wondering if you can answer any questions, or anybody can answer any questions about our nursing home and all the other nursing homes that we have in our county, since we have so many of them and they're under a lot of stress. I wondered how our health department is relating to them, or is it strictly the state health department, or are we able to help them in any way? And what are they doing about staffing and all the same questions,
in terms
ours and theirs?
So for ours, so nursing homes are generally a state regulated entity. That
That's
being
what I figured.
said, given what's going on, our Department of Health, because all departments of health have become somewhat strained, we'll say, has become the go-to related to advice on how to do or appropriately address this scenario, right? So, and not to mention, there's a lot of complaints that are coming in, right? So there's
Sure.
there's a state portal where folks can submit complaints. Of course, folks can contact us directly. I know they contact you folks directly, you forward them to us, et cetera, et cetera. So, we are constantly having our Department of Health reach out to whether it be nursing homes, assisted living, et cetera, to provide advice on how to deal with a certain scenario for nursing homes that aren't county affiliated. With those, I'm sure everyone's aware of the issues at Teresian House. And of course, there's others as well. And then there's our nursing home, which obviously Mr. Slatke is keeping close tabs on. And actually, I was actually just talking to Chairwoman Willingham this afternoon. I think that, there'll probably be a point where we set up a Zoom for members to get on to get his obviously much more detailed explanation of what's going on at our nursing home. We do have some cases, and obviously every appropriate measures being taken to protect others. I don't off the top of my head know what the current numbers are, but I know that the county executive has been mentioning them in his daily briefings. And like I said, I think we're probably going to organize some sort of briefing with Mr. Slatke just to kind of get the boots on the ground explanation of what's going on.
Thanks,
That would be
Mike.
great.
I think we have a question from Mark Grimm.
Yeah, can you hear me, Chairman Joyce?
Yes.
Okay, yeah, I have a concern about how people are being bombarded with a flurry of statistics. And this is not just a medical challenge for us, it's a public communication challenge too. And I know, for example, and Dr. Wellness talked a lot about this, positive cases alone are not that determinative. It's really, if you do a lot more testing, you get a lot more positive cases.
Correct.
So some counties are recording more positive cases because they're testing more. Well, that doesn't mean that county is any sicker than another county. So I think all the counties, all the states need to just come out with I think one of the most important ratios every day. Here's how many positive cases we have. Here's how many we tested. And that ratio, that number, I think is more significant than what our number of positive cases are, because it's really misleading because every county is doing a different amount of testing. So, what the public thinks about how sick their community is really important. Secondly, go ahead.
I would actually even venture to say, I mean, that's all fine and reasonable. I would actually venture to say a better number to go off is hospitalizations.
Yeah, I did that in there too. Yeah. How they're sick enough that they have to be hospitalized. I think that's
right,
very
because
true.
we know that within a given population that's infected, how many are going to be hospitalized, and of course you factor in existing conditions, age, et cetera, all that stuff. But the moral of the story is that that's the number that really shows if there's going to be a problem or not. It's the hospitalization rate.
Yeah.
So, and we're Department of Health is tracking that very closely.
I just think, Mike, that it's there's just so many numbers out there. Not all numbers are created equally. And I think really from a clarity standpoint, we need to horn in on a few. And the two we just mentioned, I think are really critical.
No, we stress
no.
trying to make sure we explain it as plainly as possible. I think you're right.
Because I'd like to see, because Dr. Wellness said a lot, keep in mind we're testing more, but I'd like to see that ratio from our county and other counties as well. Every day, here's how many were positive, how many we tested. I think that'd be very helpful. Also on the COVID deaths, really anyone who dies who has COVID is tagged as a COVID death. And we know that's really not accurate. There are people who are elderly who have underlying conditions that are dying all the time, but they're getting tagged as COVID deaths.
That's in our statistics. We are. So, and again, I've had the conversation with a few members, so I apologize for the repetitiveness, but with our numbers, we do we try to weed those out. So our numbers, I would say, actually shouldn't be that way.
Oh, good. Okay.
But you're right.
Not everyone's doing it the same way, though.
Yeah, there's a compounding effect. So then you have to kind of make a judgment about, oh, well, this condition wasn't as important in the death as COVID. But, that those situations get sticky. But we're trying to make it so that we can say this number was because of the virus.
Okay, good.
Thanks, Mike. I think Mr. Bergdorf had his hand raised.
Yeah, it's another question for Mike. In today's TU and also addressed partially by Dr. Whalen. They talk about the surrounding counties have reached numbers where they can their hospitals can reopen for elective surgery. And, percentage of beds available, percentage of people in ICUs. I haven't really been able to, while reading an awful lot of stuff, been able to track exactly what metrics Albany County would have to hit in order to be able to sort of reopen the medical profession. Mike, is there any way that you can help with that or get us some information?
I haven't looked at that specific scenario, Legislator Bergdorf, but I'll certainly follow up and get back to you folks.
Okay, I don't show anybody with their hands raised. Anybody have any follow-up questions?
Actually, I had a question, Chairman.
Who's that? Oh, Mr. Ricard, go ahead.
Thank you, Mr. Chairman. Just a follow about the Shaker Place Nursing Home. A couple constituents were asking me, as far as how many residents passed away from it. Someone mentioned, in addition to that, the employees. I see that as of today, I think it was 23 had tested positive. 15. Are all the employees there being tested, or just the ones that are symptomatic? Because what if there's asymptomatic?
No,
employees?
it's not. It is still, the testing is still based off of probable cause, we'll call it, right? But it isn't based on symptoms, right? Symptoms could be a reason, but it's also based on exposure, right? So you could be you may not have any symptoms at all, but you've been exposed.
But at the Teresian House, they just took 60 tests the first time, just randomly. Some staff, some people,
That's
and
what
it
I'm
turned
asking
out that they were asymptomatic. Some of them.
Yeah, so we're doing more calculated in terms of if somebody is exposed or potentially exposed, if there's any nexus between where they are and or where they're working, and whether it be a staff member or a patient. That's how we've been doing the testing. At this point, a significant number have tested, so we're approaching the majority anyway.
So
there's
another
no-
follow-up question to his question would be, we always talk about we're short-staffed
Mm-hmm.
there all the time. So if 40 people are testing positive, I'm assuming they're going to be quarantined. So that's 40 fewer people that we have working there. So that's really what my question was about earlier, about personnel. Are we able to cover what we need?
Yeah,
I know that there's a
Right
state
now,
pool of people,
right now, we're not having staffing issues.
Yeah, they're considered essential too,
how
aren't
can
they?
that be?
I think the DOH is,
Yeah.
if you're considered essential staff, I don't think they're quarantined at home if you have an exposure in the workplace. Someone got to. Does someone need to go on mute there? All right, well, Mike is under, I guess you're doing double duty, Mike, huh?
Yes, I've been doing all the committee meetings and all the items, so yes,
Yeah.
to say the least.
So do we have any more questions for Mike?
No, thank you.
Thank
And
you.
Mike, thanks
Thank
for
you.
everything you and the exec staff are doing, and thank you for, actually, can we get I don't think we ever did get a motion to adjourn, but
Actually,
you
real
for
quick,
the,
if you don't mind, Mr. Chair, I'd just like to say, I've said this at each meeting, everyone needs to know the amount of effort that majority council and the chairman's staff have gone through to make sure this process works smoothly, and frankly, it's been great. So just a quick thank you to them for perfecting a system in a challenging time.
yeah, you stole my thunder. I was gonna thank them next after you.
Oh, sorry, my bad.
No, that's okay. That's okay. Any thanks to them is welcome. So can we get a motion to adjourn?
Motion to adjourn.
Motion by Mr. Ward, second by Mr. Tunney. All in favor?
Aye.
Stay safe, stay well.
Thanks, everybody.
Thank
See you
you.
next month.
See you later.